Hi, I'm Jennifer Kent, Senior Director of Research at Parks Associates, and I'm joined here today by Stephen Bird, who's the Senior Director of Health and Wellness at Nortek, which offers the Numera line of products and services to seniors and their caregivers across a variety of solutions. It has been a challenging year all around, but connected health products and services have really been incredibly important in keeping us connected and providing really critical services to consumers during this time. So as we lead up to the show, Stephen, we wanted to get your thoughts on how this year has really changed things, particularly for the older consumers and their family caregivers that you serve, and the places where technology can really play a valuable role in serving them in new ways. But first, let's hear a little bit more about, can you tell us a little bit more about Nortek and the Numera line of products?
Sure, yeah, thank you, Jennifer, appreciate that. So not many people know the name Nortek as it is, but the sub-brands under Nortek are fairly well known. Nortek itself is a leader in the global security and control market. We make the 2 gig panels for Alarm.com and SecureNet, as well as some high-end control systems with the Elan brand. The linear brand of garage door openers is also ours as well. We have power conditioning devices, Panamax and others. And then we also purchased a analytics company that does voice recognition and facial recognition. In 2015, in July, Nortek purchased a company called Numera that is well known for health and wellness space. They have 3 generations of PERS, the personal emergency system devices, as well as MPERS, the mobile devices. There's 10 patents for the technology, including some fall detection patents as well. The mobile device can go anywhere, so it gets GPS as well, and it integrates easily with existing monitoring centers for 911 type calls around the country. So I'm heading up that specific vertical, the health and wellness vertical.
Well, you know as well as I do that COVID-19 has been particularly impactful on the senior population. We know that older adults are more at risk for poorer outcomes if they're to contract the virus. That's led to a lot of even more strict social distancing than maybe some other age groups might be undergoing. Also a need for caregivers to learn how to care for their loved ones, sometimes virtually or remotely. And this may emphasize some, feelings of social isolation that the elderly population is already, particularly susceptible to. And so can you talk just a little bit, you're really on the front lines because you are already in the senior market providing them products and services. Can you tell us a little bit about what you're seeing from the people you serve, from seniors and their caregivers? How is this time impacting them right now?
Well, I mean, clearly, like, necessity is the mother of invention. I mean, people are spending a lot more time at home. In the past, we had our professional careers at work, and we did our medicine at doctors' offices. We did our entertainment at the theaters or the theme parks. But that's all different now. They're all converging inside the home because we've all been, forced to be in our home for 6 or 8 months. So in past generations, and our parents' or grandparents' generations, that really would have been impossible. But today's technology, along with the convergence of the technology of broadband and smart home and IoT, we're actually able to realize all that at home, which is pretty exciting. And the telehealth domain and the telehealth world is really no different. Home hubs, remote monitoring devices, patient and physician portals, as well as analytics are converging to create this home ecosystem. Specifically, for our customers, the socially distant world has brought to light the need for caregivers like me, my mom lives in Florida, to be able to remotely manage and monitor my family and patients, and then for the patients to be able to interact with their physicians and other services remotely if they're stuck at home and can't make it. So COVID has affected the ability really to see doctors. And good health care not only relies on the physician, but it also relies on 2 important things: timeliness of care. I mean, you have to get care quickly for certain things like heart attacks and falls, and it requires self-management of care also. As we all know, when you go to a doctor, if you are an educated person and what the possible problems could be, or if your mom or dad are with you if you're older, you're going to get much better care. And so COVID has affected both these paradigms, potentially meaning a reduced level of health care. So these independent living technologies that we bring together allow caregivers the tools to access patients' health and wellness status and needs.
Stephen, thank you so much for joining me today. Looking forward to talking to you again during the Connected Health Summit.